Okay, I am so excited to talk about healing ourselves, healing our family, ultimately healing the world with our guest today, Peggy Ouellette, and she is the founder at Functional Family Psychiatry. Welcome, Peggy.
Thank you, Lindsay. I'm so excited to be here today.
I'm so excited. When you and I were initially talking and I was just learning a little bit more about what you do, I thought, wow, I hope our audience just opens their ears and minds and comes in ready to take it all in, to take notes, but also just to kind of absorb this. We're coming from a mental health aspect today. And really, I want to dive right into that because you say I'm passionate about changing the landscape in mental health, which to me, I want to hear how you started and then like what gently led you all the way down this path.
Totally. Yeah. So I think my first passion that I discovered early in my own life was that I loved kids. I've always loved working with kids. And I didn't realize until I started teaching some years later that not everyone has that desire or passion. Oh, I didn't know not everyone loves kids. Okay. So I just want to say that's my come from place as a kiddo,
Yeah.
And so that kind of led me down, my educational path. First of all, I was a young mom, and I, put myself through school, and I was going to be a teacher initially, and somehow I was in an interview, college admissions interview, and the person was like, "Have you thought about nursing?" And so I'm like, "No, not at all." And so,
No, thanks.
no, I'm good, And so science was not my strongest, in school, but I was a good student, and so it made me curious. And so I started thinking about that, and I ended up doing nursing, and I'm so glad that I did. So it led me into pediatric nursing. And one of my first jobs was on a psychiatric unit working with teenagers. And so dive right in. And so, and I always was concerned about teenagers. You heard all these horror stories as a young mom, like, oh, wait till your kid becomes a teenager. So little did I know that prepared me very well for life.
Yeah, yeah.
Right. So very quickly, I had some great mentors and teachers while I was working in the hospital, and I really have this drive for learning. And I went back to school and discovered, psychiatric nurse practitioner, and I'm like, okay, this is amazing. Like case studies and labs and really diving into figuring out what's going on with people.
Yeah.
So I did that. I ended up becoming a nurse practitioner. And so it really pulled together all the things that I loved, being a detective, being a teacher, working with kids and families. And so I did, I was in the field really it's been 25 years now. And so, so that's my profession part. Okay. So as a nurse practitioner, as are many psychiatrists, we become medication managers, which nobody really talked to us about in terms of our role. And so nurse practitioners tend to have a reputation of being more, holistic in a way, and, doing a little bit more teaching and education.
Yeah.
However, still, and I had my own private practice, which was beautiful because regardless of pay, I was still scheduling half-hour appointments with all of my families and really taking the time and not just doing 10 or 15-minute med checks and, doing quick turnovers. And a lot of families came to me because they learned that I did labs. And so as a teacher, I've always encouraged my students to really look beyond what's presenting in front of us. And so I would draw labs, and people would be like, why didn't anybody else do this?
Right.
Well, if I'm going to be prescribing medications, I want to know how's your liver, what's going on in your body, how, some vitamin levels, your iron, your D, some basic labs as a baseline so that we can have a starting point. And as I'm doing these labs, I uncovered a lot of things that really taught me a lot, like the kiddo who turned out had a dust mite allergy and could now return to school because we addressed the dust mite allergy. We changed some behaviors. We changed a few things, changing your bedding routinely, really made a big difference. And this kid took off, like literally. He was like 10 or 11. He started making friends. He learned how to ride a bike for the first time. Like he started showing up. Now, this kid literally presented as ADHD and maybe possibly some depression. He was falling asleep at his desk.
Yeah.
And so easy, it would have been easy enough to prescribe a stimulant, which would have woken him up, but we would have missed why was he falling asleep at his desk? He's the sweetest boy. And
backtrack for a minute. So it was the labs, just so our listeners understand, like really how it was from the labs that you found the dust mite allergy.
That's right. The labs. So I was doing baseline, like they have an allergy panel, a childhood allergy panel. That's easy. If you are a provider, it's an easy one to run. It's covered by insurances, and it was really easy. And so these, like, finding these things and really determining what the root causes were really continued to drive me in my passion and my learning. And so this sort of led me to functional medicine, essentially, and like not settling for no answers,
Right.
So, I'm an advocate, and I'm like, I'm going to find out. I'm going to figure this out. What's going on with your kid, So,
and that's why parents love you. And that's why your schedule is booked. Because, oh my goodness, have an advocate for your child is unbelievable.
Right. Why is no one doing this? Why is no one listening to me? And so, even this morning I was listening to a Parasite summit, and it reminded me of this, one of my first, teen patients, and the mom had been to multiple providers, and the kid was like 16, and she was like, it's like every full moon, he is a different kid. Like he doesn't sleep. He literally would leave the home and walk down the road like for hours and come back. And he was diagnosed with bipolar disorder. Yeah. And my heart today, and the kiddo must be, mid-20s at least right now. And probably 30. And my heart goes out to the family, and I'm like, the kid, I bet, had parasites. He had all of the classic symptoms of parasites. But if you don't get that in your educational program, you don't know that as a provider. And so,
right. So it's not a lack. It's not a lack of not providing the right care. It is do you feel like it? Because I know every listener is like, we keep hearing, why isn't it happening? And this is why, because we're not there yet. Do you think that like there just needs to be more education and more open minds coming into this functional, holistic view?
Yes, we need to get the word out there so that people understand. So one of the things that drives me is the mamas, the women, that kind of like show up in your office with a notebook, and they're like, tell me what I need to do for my kid.
Yes.
And like, I'm here, I'm open, I'm ready to listen, I'm ready to hear what you have to say. And so like for those people, in a way, it always drove me to want to learn more. They weren't just happy with a pill. They asked questions, and they knew their kid. They knew something wasn't right. Something was being missed, because I don't know how many families would go to, and even in my own office, the labs look normal. On paper, according to the guidelines of that lab, they were within a normal range, but it wasn't per se optimal for that kid. And something was still being missed that doesn't show up on routine labs.
Right. I could start crying because I'm sorry if I do on you, but I feel like whether it's a parent for a child or whether it's ourselves, that we do hit this, like, I know myself, but everybody else around me is telling me I'm wrong. And so at some point people cave and just go, I guess this is what it is. And then you're this breath of fresh air coming in going, hang on, we're going to keep investigating then. I believe you, and we're going to keep looking.
Yes.
Oh, so good. Sorry,
Yeah.
I keep interrupting.
And truly, it's great. So, and truly, like, I'm kind of deep in my journey now, but, fast forward, really not in the too far in the recent past or too far back in the past.
Yeah.
I had my own health issues. And, I remember as my body was changing and I was getting older, I remember going to an OBGYN doc. And I'm like, okay, this is great. She's a woman. I can talk to her about these things. And I'm like, doc, like, I don't feel good in my own body, and she's like, this is normal. You're, going through menopause and you're this, and like, it's normal. And I'm like, I never went back.
Mm-hmm.
There were some other things, but I'm like, I literally never went back to her. And I'm like, this is not normal. And so, I go to my own doctor and I'm like, I'm experiencing these vague symptoms. And so I encourage her, and she's great. She's like, hey, I know you know what you're talking about. Like, of course I'll order some labs for you. Everything came back normal, literally. In more labs, all normal. And so I've been there as far as that goes, and it was really difficult and frustrating. And so I experienced that low level kind of brewing over a few years, which I now can look back and see that this process is happening for a lot of people. This doesn't happen overnight. It started slow and low. And so rewinding to my own, parenting side of things, I had challenges with my own kid. He had some difficulties in school. He struggled with his own depression. And, here I am. I'm like, truly, I was dubbed, this woman I ran into a few years ago. She's like, oh my God, it's the world's best babysitter. Like I knew what I was doing. I was like, I love kids. I know kids. I can talk to kids. And at the same time, headbutting with my own kiddo.
Right. Yeah.
And, to this day, we have a very strained relationship. And one of the pieces that I noticed in doing all of this education and this process, and one of the things that I realized is it has to start with us. Can you hear that? It has to start with us. Okay.
Say it again.
Yeah. Okay. And I didn't know. And so, like, as I'm looking, I'm a bit of a systems thinker. So I think that's my come from as a kiddo. Like, I always can see the big picture. Maybe it's growing up in a big family. I don't know. But like, I could see, oh, that one needs more water, or that one hasn't, been fed yet. Like, I could always see those things.
Yeah.
And what I'm seeing in this landscape is all of my peers that are treating chronic substance abuse, chronic autoimmune disorders. We're seeing rates of things, diagnoses are just blowing up right now, And so I'm like, all of those people, when I look at providers and even in their own stories and their own journeys, they're like, until I really targeted and treated my own childhood trauma, I never really got better.
Interesting.
And so we have this medical side of things, where it's like, okay, I can draw labs all day long. I can look at that and look for something, look for what's going on in your body.
Yeah.
And yet that piece of, nobody got me, nobody understood me. And that's in a way partially where my own story comes in. Like, I believe that my son feels like I didn't see him. I didn't hear him. I wasn't listening, even though I'm like doing everything I'm supposed to. We've got sport, like you name it. Salad. We ate salad. We had dinner every night. We did fun things together. And at the same time, there was some friction in there. And I do feel like that's a piece of it. And so kind of like when I have parents who are ready to implement changes, a lot of times they're like, how am I going to get him to agree to this? How am I going to help somebody make changes? And so what I have discovered is you have to help your kid feel seen and heard, and they will show up for you. right? So that's where starting with ourselves and knowing what helps us be seen and heard,
Right.
and helping us heal those parts of us that as our in our own childhood, it literally all trickles downhill.
Can you keep going with examples on that? So like,
Sure.
For you, what was seen and heard, and what have you noticed within your son that's kind of made of this aha, it's better moment?
Sure. So, I see this, let's just say like in my own life, in relationships in general, when you are, and think about this for your own self and to your listeners, think about a moment where you're like, they get me. They just heard me. It lifts you up. It rises you up, and it energizes you. And I see it with kids as well. So when you are connecting with them and they're like, oh my gosh, you get me, you hear me, they'll do anything. They're going to show up in a way that, most of us are like, but my kid won't listen. My kid isn't hearing me. They're not doing these changes that I want them to make. That's because the boat is being missed. The kid's still not feeling seen and heard. And so like figuring out their love language is an example. What is your love language? Like, do you know what your love language is, Lindsay?
Oh, absolutely. Words of affirmation.
Okay.
I really like leave me a note and I'm yours. I love notes. I love.
Right.
Yes.
Right. So what did you just say? You leave me a note and I'm yours. You're like, Your heart is getting, your loving cup is getting filled.
Yes.
Right. It's a simple tool. And, there's no connection to love languages, but you can go to 5 lovelanguages.com literally, and it just takes a few minutes and you can do a quick, down and dirty, quick survey, and you can find out what your love language is. And there's love languages for kids. But if you communicate in a way that allows your child's loving cup to be filled, like, dude, like seriously, like it makes all the difference. And you can test this out. Like, it's so helpful in a way, like these podcasts where people walk away with a simple, easy thing to try. And you're like, what does this have to do with mental health? Well, it has everything to do with mental health, because this is where we start. Because when you're working with me, we're gonna go into, a whole different line. We're going to go into nutrition, and I'm going to teach you how to feed your family, but really how to feed yourself, and how to start with you first as a mama. And then it all is going to trickle down. But when you understand your own love language and your own kids' love language, it's like you got the key. You've got the right key that's fitting in the lock, and it works.
Yeah.
It's incredible.
And don't leave this for a minute, because I agree with you. I think this could be the one thing, if everybody wants to turn off the podcast now, you could walk away. And if you've never heard of love languages, that's where you have to start, right? Like, and you're giving them, we'll put the website in the show notes as well. But our pastor actually, and I was going to say, this comes in from a relationship standpoint too. When we were getting married, he was like, this is my gift I give all my couples. And I had never heard of it before. And I'm telling you, we literally talk about love languages almost weekly, because even from that spouse relationship where you're going, you're not leaving me notes. And he's going, I'm full-time working, like, he's the breadwinner. And I'm like, thank you, but that's not my love language is, and it's just so funny, because somebody else from the outside can be going, you're so crazy. And it's like, if it doesn't touch like what you're saying, if it's not filling your cup. So I love thinking of that with our kiddos too. And I guess we naturally do that a little bit, but to really ask them and like take a quiz like that, what is their little love language? Thank you for bringing that up. That's awesome.
Yes. And truly, like, you may have some younger listeners that aren't mamas yet. And one of the things that you can do is be intentional. So like, if you might have no kids, you may have toddlers, you may have teenagers, or, young adult or adult kids. Like, I don't know what your age, listening range is. But if you are a new mama and you have babies, we can be intentional about and it really doesn't take long to get this in your own body, but to understand you can actually fill, there's like 5 love languages. There aren't that many. You can be intentional and fill your baby's 5 loving cups, or they're utilize and address the 5 love languages. And in a way, this sets them up for that feeling of safety and security and, limbic system, connections at a younger age.
Interesting.
I believe this is how we're going to change the world, because if we start our babies' brains and neural pathways, building and connecting right away, like it's a game changer.
Can you rattle them off? I know people are going, I've never heard of this. What are the 5 love languages?
Sure. So words of affirmation, touch, gifts. What else am I missing? Quality time, and which is actually my primary love language is quality time, and acts of service. Yes. So when you're doing something for somebody. And so there are some easy ways that you can actually just make it a habit. So you don't even thinking about it anymore, but you just have to start where you're at. So, this is a really cool way of starting your children on a different path. And in a way, like for you, Lindsay, how do you communicate to your partners? And so in a way, we again come back to, we have to start with ourselves.
Yeah.
And yes, sometimes with your mate, sometimes we have to beat them over the head with it a little bit and remind. And at the same time, what am I doing to fill his loving cup?
Right. Yes.
Right? Because when we're filling their loving cups, your mate, you get it back. You just, you have to just, again, start with you. And it took me a long time to get that part. And I'm going to keep going. Yeah. I just want to we have to start with us. And I did forget my thought. So you can jump in if you want.
Oh, no, it's because I keep interrupting you.
That's okay.
But just to kind of close out some of those thoughts too, if any listeners are out there thinking, I'm not in a good relationship state, a lot of times therapists do have you come in individually before you'd start any couple therapy. It's the same as what you're talking about. And your message is so brilliant and spot on. And if everybody could just take away, it comes back to, you can't pour from an empty cup, right? And so if we, the person who are wanting to be this provider and this mom and wife, and we've got to love ourselves first, which is what you're shouting at the top of your lungs. And I love it.
Yes. And that's where somebody called me the whole family healer. That's my whole family approach, because when we start with us, your relationships get better. So everything gets better. Your relationships with your kids, your mates, everyone. So,
it's the ripple effect,
right?
What the heck? Ripple. That they're like, how is my spouse relationship going well now that my kids are working? I think it's so cool to think that.
So I know what I was going to say now. So it's easy to blame it on the other person. So this is kind of the mindset shift. So this is where I wanted to go next is, in a way, it's easy to show up in the doctor's office and say, plant your kid on the couch is he's not focusing in school. Or, taking your kid from doctor to doctor to doctor, trying to figure out what's wrong with them. And in a way, that's missing the boat. So when I first started on a psychiatric unit, inpatient, I learned very quickly, which was one of my very first lessons, is behavior has meaning. And so I want to say that again, behavior has a meaning. So when our kids are acting out, we need to try to figure out and be curious about it. What is going on? What's contributing to that? So it's easy to blame the husband or the mate and say, well, he's not doing such and such. Well, kind of think about what's the root cause of that? Why is he not filling my loving cup kind of idea? And what can I do differently? And so taking responsibility for what's happening in our lives and not per se identifying the kid as what I've always called the identified patient. Right. So the kid, kids would come into my office for treatment of childhood disorders, will say that the kid is the identified patient. And at the same time, it's actually the kid is a symptom of what's going on in the family. So it's not just, it just happens to be that's the symptom, And so, yeah, go. Yeah. So
right. The identified patient is so interesting to me. Yes. Yeah. No, keep going. So this word functional that you use within this, function, like family functional, because in fitness, functional means we get to use it as our daily life. So whatever we're putting in as effort into training that muscle group, it's because it's going to help lift the grandbaby, or that muscle group's going to help do something specific in our life that we need at that moment. And so you use that word a lot. And again, have we already talked about this, or is there more to that functional component?
So no, we haven't per se. So when I closed my practice, which was just in 2020, I literally woke up one morning and I had already been in a mentorship and already done all kinds of training in functional medicine. And I'm like, I was going to do this slow transition and continue with my med management clients and then I'm like, I woke up one morning, I'm like, you can just close your practice. And I literally that morning, first patient of the day, I'm like, I just made a decision. I'm closing. And they're like, the response was amazing. They're like, that's awesome. Good for you. This is great, because they've known me forever, Yeah. And so, my initial thought when I made those decisions was, I'm going to do labs. I'm going to help people. I'm going to find out, is it heavy metals? Is it, parasites? What is it going on with their kiddo? And reflecting back on, folks coming to me previously, people don't per se need more labs. Yes, that comes later, but so one of the things I learned is that when we change our environment, people get better. So when we clean up, our food, when we clean up the air, when we clean up, all of that, we get better and the symptoms start to slough away. And so how I design my program is to work with families where they're at, figure out what's working well, and to teach them how to nutritionally give their kids' brains what their brains need. Yeah. So that they can optimize, because our bodies are amazing. Our bodies already know what to do. And so families are like, what do I do? How do I fix this behavior or this symptom? He's not focusing. It's the wrong angle in a way. It's too limited in its scope. The inattention is only one component of what else is going on. And so we have to look at the whole body and the whole family. And when we start changing what's going in as our fuel, then our body functions at a whole different level. So by starting with that piece, a lot of people don't need to come and see me anymore. And so that's the piece that I really wanted to get away from is as my kids in my practice would be they're turning 18 and they're like, hey, my pediatrician is you have to go see an adult doc. They're like, am I going to have to go see a different psychiatrist? I'm like, I can see you till you're 99, that's it, and so, and I could see what path we were going down, come in and see me. They look forward to it every month, and maybe every 3 months, and routinely prescribing their medications, doing their random labs and checking up in their bodies. But I'm not seeing a way to affect change in the world this way. There are plenty of people that will prescribe medication that help, with your symptoms. But that's not what I want to do anymore. I don't want to keep people coming to see me. I want to teach families, I want to teach mamas how to, show up for their kids, 24/7, like in a way that is meaningful so that their kids' brains have different outcomes. And like we can start lowering the numbers of autoimmune and, schizophrenia and Alzheimer's and you name it, like it's all related.
Wow. So good. Yes.
Yeah.
And so this looks like, I feel like it's still a little unclear what your day-to-day looks like at the moment.
Sure. So I have a group program. And so my day-to-day now is no longer prescribing medications. I am working with the person's prescriber. So a lot of people are able to lower and or come off their medications of different types. And so I'm really working with the family. So they enter into my 12-week program and then they continue with me, at a different level, but they're all of the education step by step is there for what they need to do essentially. And I'm there every week supporting them. And, at the intake, we do like a symptom, essentially a pretty thorough symptom checklist. And so like it gives me some guidance in terms of what's going on in their body, and still no labs have been drawn.
Okay.
It's such a different mindset shift for me, unless somebody's in an acute state, like there's an exception to every rule and everything is truly individualized. And so I work with the family wherever they're at and really help them to make these shifts, one shift at a time. And, I'm there for as little or as much support as the family needs.
This is awesome. And so for our non-medical community, an intake for them looks like their family's coming in, you're getting input from the child, you're getting input from the adults in this family, and then figuring out goals / a game plan to move forward until they come see you again. And then you assess and you would keep game planning.
Big time. And so one of the things I'm in development for is a more comprehensive gut healing program once they've done the fundamentals. Because, and again, this is stuff that my families have been telling me for years in my office. And I was somebody that heard them, hey, when we sent my kid next door and he had that blue Gatorade at the neighbor's, birthday party or whatever. And they're like, and he was in a meltdown mode for the whole rest of the day. They're like, that was the only thing that was different. Like those kids were easy to figure out, like, oh, there's a dye allergy.
Yeah.
Right. But again, going back to even like in my own body and my own symptoms, a lot of these things are low level and they brew. And so like disease doesn't happen overnight.
Right.
And that's where we can really, affect change with our own kids. Is really helping, like lowering the toxic load in the home, in our water, in our food, which can be really simple, truly. It's not always easy, but it can be very simple. And once you know this, you can't unknow it.
True.
True. You can't unknow it.
I think because you brought up the word simple, this is a great time to talk about this too.
Sure.
I notice that parents, and I want your opinion on all of this. If you are already in overwhelm, and call that because you have other little ones, let's say it's your oldest that's having the issue and you literally still have a baby and a 2-year-old, your brain is just, you're hearing this and you're going, I don't have the brain space to think about tracking their food even during the day, let alone, like really diving in. And this is where I think you're going to come into play. You're hand holding them through it. Or they go, what do you mean my water is not good? Or what do you mean go through how you talk to your families about all of this.
Totally. And so in a way, when you talked about the overwhelm and I can't handle another thing, and part of that is getting that brain to calm down, the limbic system and the response and the reactions to calm down. And so truly by having, if a family is in big overwhelm like that, we pick one thing and we said, what are you willing to do? Let's do this one thing and let's put the energy in there. If it means, breathing for 3 minutes in the morning before you get out of bed, like we keep it as simple as needed, whatever they're willing to do. Because going back to the tracking piece, I'm not really having people track in the same way that I was. And I couldn't get it. I couldn't figure out, like, if you track your kids' bowel movements it will help you uncover, what's going on for him. But like families just, I couldn't understand why people weren't doing it in a way, because it isn't easy to do. Like, oh, let's write this down. And for some, like there are people out there that are like, oh yeah, we got this, we got a chart, give me a form and I'll fill it out. So again, starting, like I would say, when you're thinking about feeling that overwhelm, just start with being curious. Be curious. And if people are listening to your podcast, like they're already curious, they're already learning, and they're already interested in the world, right? And so be curious about your family. Be curious about, why is it that I have 20 extra pounds? Or why is it that I'm feeling exhausted every day? Just be starting there, and know that it doesn't have to be this way. And I think that hope is really what helps people pull out of the overwhelm, and keeping them laser focused on what their want is, what their goal is, what their desire is. And we keep them focused. And that's their why. What is their own personal why?
Right. Oh my goodness. I 100% agree with you with the belief system, like you're saying, the hope or the faith of that I even can change anything. Because if you can't even start there, then everything's overwhelming, because you're like, I'm going to fight and I'm still going to get to the same answer again. So
yep, exactly. So in this context, it's a lot different than a 30-minute med management follow-up appointment. So I can do that work and do the support that the families need and want and are ready for. They're like, I know my kid could be doing better. And I can see us, sitting on the couch, before bed, and we're getting up and we're still tired. Like whatever that energy is that's going on in your family. And you're like, I know this isn't, like, we shouldn't be feeling this way, but I don't know how to shift it.
Change
and so
it. Yeah.
I really keep it simple for people.
I feel like my community understands membership to a certain extent, and like the ability, how we all get to consistently lean on each other and for accountability. But I'm hearing more program out of you. Is there a start and a stop to when you start seeing these families, and how often do you see them before kind of a finish up?
We spend some time at the beginning in terms of preparing them for the program and kind of outlining the laying out the landscape, so to speak, and the community piece. So one of the things, I've been in mentorships now for a few years, and one of the things I realized early on is that when you are investing in yourself, but it's not just having a one-on-one coach per se. And I'm not sure, Lindsay, if you're doing group or if you're doing one-on-one, but
both.
So one of the things I learned for myself and what I see with others is that in the group, in the community, we're like 10 timesing our investment, because we're getting the benefits and the support of the community within that context. And so you don't always know what question to ask. You didn't even know sometimes that was a thing, Right. And so whether you're, I'm doing some sort of hot seat kind of coaching in the group, everyone else is learning from that. And so, it's not just a half an hour with Peggy every month, or 3 months or 6 months. It's hourly. It's an hour every single week, an hour and sometimes 90 minutes every week. And of opportunities for coaching, and it works.
It does work.
Everybody's there to support each other. One of the things, like when this pandemic hit, like loneliness and lack of community and connection, like there's some studies, which I don't have off the top of my head, about the impact of just that piece.
Yeah.
And so we have to rebuild that sense of community and connection, and it works. That's when people really get better. A lot of people are like, oh, I don't want to be in group therapy, or like there's like that own resistance until they experience it. And they're like, okay, I get it now.
There's a lot of resistance. Like, we're going to sit around in a group and I'm going to hear other people complain, and I'm already busy and I don't have time for this. And it doesn't feel like that. No. It's like-minded individuals who I can just picture in your groups, these moms going, this is working for me. You can try it or not, or I'm struggling with this.
Totally. totally. It's quite incredible. I love it.
Yes.
I'm in constant evolution, So I want to jump back to the tracking piece.
Yes.
So, you're like busy people. So one of the big game changers, and I'll show you, like, I have this Aura ring on now, but a lot of people have like eye watches. They, Fitbits were a thing in the past, like these sleep trackers. So, maybe a year or so ago, I got an Aura ring. I had heard about it, and it has changed so many of my own behaviors that I didn't know were impacting me. So in a way, it has become an easy way. So I'm not having to per se chart all of my stuff every day. But one of these things is it tracks my sleep. So I started seeing some of my things that I was doing, going to bed late was one for me. Snacking before bed it was just a habit. Like, oh, got a snack, brush your teeth, go to bed. And one of the things that my Aura ring literally will be like, oh, it looks like you ate late last night. Your heart rate dropped. Like, I'd be like, darn it, And so,
darn you.
Right. So, it just like started making me more aware. So we already have, so again, for your listeners, if you're like, where do I start? Like, pull out get the dust off, the proverbial dust off your old device, your tracker, and use it, and like start looking at some things that you can do. I have, I'm starting to wear my screensavers. So my numbers would drop significantly when I would have meetings in the evening. And so that screen time was activating me, and it would take me forever to fall asleep. So I started wearing my blue light blockers at night. No problem. Huge difference. And so even in the daytime, I'm wearing, these have like the screensaver, and then they have like, and then there's another color that goes on at nighttime, and I'm wearing them, and it's helping. It's
and
like,
you can see it on your yes.
Yes. So, and this didn't all happen overnight, but I'm like, no, Peggy, even though these glasses don't really fit you that well, and they're like not that pretty, they're working. You know what I'm saying?
I think it gives you this great little image of exactly who I want to listen to right now. I'm loving them.
Cool. So, but my point is that like, these are pieces that we can do some small shifts and like really valuing your own self. So when we take care of ourselves and we prioritize ourselves, we can show up for our families.
Yeah.
We can be present for our kids, and we can like literally help them feel seen and heard because we're more grounded. We're awake.
Yes.
And it's amazing. Everything gets better.
Let's just make sure no one took awake as, let this sink in for a second, listeners, that awake doesn't mean we're literally awake. It means that we are not just zombies walking through our day, clicking off the checklist. We are intentionally there with our kids. We're listening. We're doing, I love this from one of my other podcast interviews, stop, drop, and fold. So like you stop everything you're doing, you drop whatever's in your hands, your phone, and you fold your hands and give your attention. And that's kind of how I envision being awake, that we're just very present.
Yes. There's a little story that like this image keeps popping into my head, but I was hanging out with a friend, and her little boy was like 5, and we were just sitting there chatting, and I don't know if it was something that was said or something that triggered this kid, and he like started having a meltdown, and I'm like, oh, I wonder what's going on with him, and so I kind of stepped back, but really like, and he's upset, and he drops himself right there on the floor, and he puts himself into a child's pose. And within a few minutes, this kid gets up, kind of like brushes himself off, and he's like, I'm going to go get myself something to drink. And I'm like, what just happened here? And so I'm like, so when mama's doing yoga and taking care of her body, and she's breathing, and she's really showing some emotional intelligence by talking with your kids and listening to their words and help, then the kids know what to do, because our kids be who we are. And so when you know what to do with your own body, and like, oh, I'm tired, and like, I'm going to go to bed, and we model that for our kids, they know what to do.
Right.
And like this happened all organically. I'm just a witness to this event. And I'm like,
he was self-soothing.
He was self-soothing. He knew what his body needed. He was upset. He knew how to self-soothe, and he got up and like literally within
I'm better.
Right.
Which is amazing because adults can't even do that sometimes, right? Like I feel like
yes. Right. So as mothers, how are we supposed to teach our kids if we're not listening to our own bodies? Right. And so if you're puffy or you have some low-level brain fog, I had multiple chemical sensitivity. I had mood changes from my own environment. I got a chance to witness it from my own angle. And I'm like, oh my gosh, those poor families, like how many families are experiencing these things, and when they're like, oh, it's like a switch happened. That happened to me, like literally. And I'm like, oh my gosh, I didn't even know like that. Like this is what it felt like. And I'm like, I need to help people get out of that, and to know it doesn't have to come with a diagnosis. It doesn't have to be bipolar or anxiety or all your labs are normal. And like, you got to go see a psychiatrist because this is not, you're fine. Your body's fine. But, this is anxiety or this is your depression. I think that's a pile of poop,
Yes. There's
like,
other ways. There's
Yeah.
I always feel like it's like blending of everything, right? There's like a place for things, but that we've leaned too far into this place and that we need to get this nice shift back towards there's just options and understanding what's out there. That's why I love doing this together is this opportunity to be like, there is a Peggy out in the world and we have access to you because do you work virtually as well?
All virtual. Yep. Yeah.
Okay.
So I closed my brick and mortar practice and stepped out of there. Yeah. And it's like, it's amazing.
But I think that's the beautiful thing is that it doesn't shut us off to hearing like, okay, this is awesome that Peggy's out there, but I live in Arkansas. You don't live by me.
Right.
Yes, but I could still use you. And
yes.
And I don't want to wrap this up, but I need to be conscious of your time and maybe I could keep asking you 1,000 questions, but I always send my guests out with this question. Do you have a common way that you leave your families or a phrase that you always say or something that you want to pour over our listeners today?
Well, one of the things I like to say is do it for you, do it for your family, do it for your kids, do it for your family, basically, do it for them. So a lot of people are like, I don't need to meditate. And this was me. I was like, I don't need I get meditation. I can't focus on it. My mind's too busy. But like for a lot of people, doing it for themselves isn't enough.
Right.
So do it for your kids, do it for you, do it for your kids, do it for your family. And so when you start making changes, it's going to help everybody else. And you're the person, you're the CEO of the family. For a lot of women, they're the CEO. They're the ones that have the big picture. They're running around, they're doing everything. Well, we know, everything comes from the top. And when you're doing it for you, you're doing it for your kids.
Mm-hmm.
And
I love that.
We have to teach our kids how to listen to their bodies and to know what their body needs. And when I ate that thing, or if I had a gut feeling, I know how to communicate that to my parents and they're listening to me.
Yes.
And we're going to do something about it.
Mm-hmm.
It's pretty simple in a way. Yeah.
Yes. Oh, thank you so much for all of your beautiful wisdom. We're so lucky to have you today.
Thank you.